In babies, the most common cause of stridor is laryngomalacia, which is caused by floppiness or softness of some of the cartilages around the voice box, where when they are doing anything where they're working a little bit harder to breathe, like crying, eating, sometimes even during sleep, you start to notice some of those stridor noises. The good news is most laryngomalacia resolves on its own just with time, but there are some patients who have severe laryngomalacia and there are surgical interventions that we can do to help in those cases.